If your mother, your father, your grandmother, or anyone you love over the age of 70 is taking any of these 5 medications right now, you need to pay very close attention to what I'm about to say because this could genuinely save their life. I'm not being dramatic. I'm not trying to scare you. I'm telling you this as a physician who has spent years watching older patients come into my office suffering from side effects that were completely avoidable. Side effects that started not because of a disease, but because of a pill that someone told them was helping them. And here's what breaks my heart. Most of the time, these medications were prescribed with good intentions. The doctor wasn't trying to hurt anyone. But medicine is not one size fits all, and what works beautifully for a 45-year-old can become genuinely dangerous for a 75-year-old. The body changes. The kidneys slow down. The liver doesn't process things the way it used to. Muscle mass decreases, fat distribution shifts, and suddenly, a medication that was perfectly safe 10 years ago is now building up in the system, causing confusion, causing falls, causing internal bleeding, causing a cascade of problems that everyone assumes is just old age, when really it's the medication doing the damage. My name is Dr. Thais Aliabadi, and I want to be very clear about something before we go any further. I am not telling you to stop any medication without talking to your doctor first. That would be irresponsible and potentially dangerous. What I am telling you is that you need to have a real conversation with your doctor about whether these medications are still appropriate, because in my experience, that conversation doesn't happen nearly often enough. Doctors get busy, appointments are short, and too many older adults are left on autopilot, refilling prescriptions year after year without anyone stopping to ask whether this pill is still doing more good than harm. So, let's talk about this. Let's go through these 5 medications one by one, and I'll explain exactly why I would never want my own mother taking them after the age of 70. The first medication I want to talk about is one that millions of older adults take every single night, and that is Diphenhydramine. You probably know it by its brand names, Benadryl, or sometimes it shows up in sleep aids like Zizquil or Tylenol PM. Now here's the thing, when you're 30 or 40 and you can't sleep or you have allergies, taking a Benadryl seems completely harmless, and for younger people, it mostly is. But after the age of 70, this medication becomes a completely different animal. Diphenhydramine is what we call an anticholinergic drug. And what that means in simple terms is that it blocks a chemical in your brain called acetylcholine. Now, acetylcholine is absolutely critical for memory, for clear thinking, for focus, for coordination. When you block that chemical in an older brain, you're not just causing a little drowsiness, you're causing confusion, you're causing disorientation, you're increasing the risk of falls dramatically. And here's what really scares me. There is growing research, and I'm talking about serious peer-reviewed studies showing a link between long-term anticholinergic use and an increased risk of dementia. Let me say that again. Taking medications like diphenhydramine regularly over time may actually increase the risk of developing dementia. And yet, I see 70 and 80-year-old patients who have been taking this every single night for years because nobody told them to stop. Nobody offered them a safer alternative. If my mother came to me and said she was having trouble sleeping, I would never hand her a bottle of Benadryl. I would talk to her about sleep hygiene. I would look at her other medications to see if something else was disrupting her sleep. I would consider safer options if absolutely necessary. But diphenhydramine after 70 is something I just cannot support. The second medication on this list is one that might surprise some of you, and that is a class of drugs called Benzodiazepines. These include medications like diazepam, which is Valium, lorazepam, which is Ativan, and alprazolam, which is Xanax. These are commonly prescribed for anxiety, for sleep, sometimes for muscle spasms. And I understand why they're prescribed. Anxiety is real. Insomnia is real. These are legitimate problems that deserve legitimate treatment. But benzodiazepines in older adults are like playing with fire. After the age of 70, the body metabolizes these drugs much more slowly. That means they stay in the system longer, they accumulate, and the effects can be devastating. We're talking about extreme sedation, confusion that can mimic dementia, and most critically, a massively increased risk of falls. Now, let me put this in perspective for you. A hip fracture in a 75-year-old is not like a hip fracture in a 30-year-old. For an older adult, a hip fracture can be a life-ending event. The statistics are genuinely frightening. A significant percentage of older adults who suffer a hip fracture do not survive the following year. And one of the biggest contributing factors to falls in older adults is medication, specifically sedating medications like benzodiazepines. I've seen it happen too many times. A patient is put on a low dose of Ativan for anxiety. They get up in the middle of the night to use the bathroom. They're groggy, they're unsteady, they fall, they break a hip, And everything changes from that moment forward. If my mother were dealing with anxiety, I would explore every other option before I would ever let her take a benzodiazepine. Cognitive behavioral therapy, lifestyle modifications, other medication classes that don't carry the same fall risk. There are options, and they need to be explored. The third medication I want to discuss is a category of drugs called proton pump inhibitors, or PPIs. You know these as omeprazole, which is Priloc, esomeprazole, which is Nexium, Lansoprazole, which is Provicid. These are the acid reflux medications, and they are everywhere. They're over-the-counter, they're cheap, they're effective at reducing stomach acid, and because of that, people start taking them, and they just never stop. I have patients who have been on omeprazole for 10, 15, even 20 years, and for a long time we thought these were basically harmless. But the research over the past several years has changed that picture significantly. Long-term PPI use in older adults has been associated with an increased risk of bone fractures. And the reason makes sense when you think about it. You need stomach acid to absorb calcium properly. If you're suppressing acid production for years, you're impairing calcium absorption, and that means weaker bones. In a population that's already at high risk for osteoporosis, that's a serious concern. But it doesn't stop there. Long-term PPI use has also been linked to kidney problems, including chronic kidney disease. It's been linked to an increased risk of certain infections, particularly a very dangerous gut infection called C. difficile, which can be life-threatening in older adults. And there's even some emerging research suggesting a possible link to cognitive decline, although that research is still in its earlier stages. The point is this: PPIs were never meant to be taken forever. They were designed for short-term use, typically 4 to 8 weeks, but because they're available over the counter and because they work well for symptom relief, people just keep taking them indefinitely. If my mother had been on a PPI for years, I would work with her doctor to develop a plan to taper off safely, because stopping abruptly can cause a rebound effect where acid production surges. It needs to be done carefully and gradually, but it needs to be done. The fourth medication I would never let my mother take after 70 is a muscle relaxant called cycloenzaprine, which many of you know as Flexeril. This is commonly prescribed for back pain, neck pain, muscle spasms, and it's one of those medications that gets prescribed almost reflexively. Someone comes in with back pain, they walk out with a prescription for cycloenzaprine. And in younger patients, fine. It might cause some drowsiness, but it's generally manageable. In older adults, though, this drug is problematic on multiple levels. First, it's highly sedating. We're talking about significant drowsiness, dizziness, impaired coordination. Again, fall risk goes through the roof. Second, cycloenzaprine has anticholinergic properties, just like the diphenhydramine we talked about earlier. So, you're getting that same effect of blocking acetylcholine in the brain, contributing to confusion, cognitive impairment, and potentially increasing dementia risk over time. Third, this medication can cause urinary retention, which is already a common problem in older adults, particularly in older men with enlarged prostates. And fourth, the evidence that muscle relaxants actually provide meaningful long-term benefit for chronic pain is really quite weak. The studies show modest short-term benefit at best. So, you have a medication that carries significant risks in older adults and provides marginal benefit. That math just doesn't work for me. If my mother had muscle pain or back pain, I would look at physical therapy, gentle exercise, topical treatments, heat therapy, and other approaches that don't come with a laundry list of dangerous side effects. The fifth and final medication on this list is one that many of you might not expect, and it's a medication that is often considered routine, and that is a class of drugs called sulfonylureas for type 2 diabetes. These include medications like glipizide, glyburide, and glyride. Now, let me be very clear. Managing blood sugar in an older adult with diabetes is important. I am not saying that diabetes doesn't need to be treated. What I am saying is that these particular medications carry a risk that is particularly dangerous for older adults, and that risk is hypoglycemia, or dangerously low blood sugar. When blood sugar drops too low, you get confusion, dizziness, sweating, rapid heartbeat, and in severe cases, seizures, loss of consciousness, and even death. Now think about that in a 75-year-old who may live alone, who may not recognize the symptoms of low blood sugar, who may not be able to get help quickly. The consequences can be catastrophic. Glyburide in particular is considered one of the most dangerous because it's long-acting, meaning its blood sugar lowering effect can persist for hours, making prolonged and severe hypoglycemia more likely. And here's something that many people don't realize. As you age, your kidney function naturally declines. And since these medications are cleared by the kidneys, they can build up in the system, making hypoglycemia even more likely and even more severe. There are safer alternatives for managing blood sugar in older adults. Metformin, when kidney function allows, is generally considered much safer. Newer drug classes like SGLT2 inhibitors and GLP-1 receptor agonists have shown impressive safety profiles and even additional benefits like cardiovascular protection and kidney protection. The treatment plan needs to be individualized, of course, but if my mother were over 70 and her doctor wanted to put her on Gloride, I would be on the phone that same day asking for a different approach. Now, let me bring this all together because I think there's a bigger message here that goes beyond these 5 specific medications. The bigger message is this: getting older does not mean you have to accept being on a dozen medications without question. Every medication carries risk, every single one, and as the body ages, those risks shift, often dramatically. The concept I want you to take away from this video is something we call deprescribing. Deprescribing simply means the intentional supervised process of reducing or stopping medications that may no longer be necessary or that may be causing more harm than good. It's not about refusing treatment. It's about making sure that every pill someone swallows is genuinely earning its place. I want you to do something for me. If you have a parent, a grandparent, anyone you love who is over 70 and taking multiple medications, sit down with them, look at their medication list. Bring that list to their next doctor's appointment and ask the hard questions. Is this medication still necessary? Are there safer alternatives? What would happen if we tried to reduce the dose or stop it altogether? You have the right to ask those questions, and a good doctor will welcome them. I'm Dr. Clarence Martin, and I make these videos because I believe that knowledge is the most powerful medicine there is. If this video opened your eyes, if it made you think twice about a medication that someone you love is taking, then please share it. Send it to a friend, send it to a family member. You never know whose life you might help protect. And if you haven't already, subscribe to this channel because I'm going to keep bringing you information like this, information that could genuinely make a difference in the health and safety of the people you care about most. I'll see you in the next one. Take care of yourselves and take care of each